South Africa's conduct will determine when the third wave of COVID-19 hits. Women's Day in the midst of a pandemic brings harsh realities to light, and hospital cases reported from the J&J vaccine trial in South Africa. These are the top coronavirus headlines from this week. We at African News Agency have been tracking the critical moments for you, and we've wrapped it up in 3 minutes. Health Minister Zweli Mkhize said the behavior of South Africans would determine when the third wave would possibly arise. Mkhize was responding to questions in the National Assembly on Wednesday and said the third wave of infections could hit the country if people do not adhere to health protocols. The Easter weekend in April is likely to be a contributing factor to the rise in cases if South Africans host mass gatherings with poor ventilation and do not adhere to mask wearing and sanitizing. Experts, including South African Medical Association chairperson Dr. Angelique Coetzee, estimate the third wave could arrive in June or July. The estimated arrival of the third wave coincides with the annual winter respiratory flu season. Monday marked International Women's Day, a day celebrated in the midst of a global pandemic and where harsh realities were brought to light. Earlier this week, the World Health Organization released a global study on the prevalence of violence against women. The pandemic has also sparked a parallel epidemic of violence against women worldwide, with skyrocketing domestic abuse, trafficking, sexual exploitation, and child marriage. The report found that about 1 in 3 women worldwide have been subjected to either physical or sexual intimate partner violence or non-partner sexual violence in their lifetime.
We also noted that one of the consequences of the social restrictions put in place to suppress transmission of COVID-19 has been an increase in violence against women. Today, WHO is launching a new report that represents the largest study ever conducted on the prevalence of violence against women.
A few cases of hospitalization and allergic reactions have been reported by some healthcare workers who received the Johnson & Johnson vaccine. Professor Linda Gale Becker, who is co-lead for the clinical trial in the country, said that adverse reactions were anticipated and manageable. Becker said that only some healthcare workers experienced severe allergies, but others mostly experienced a headache, sore arm, a bit of fever and fatigue for a day or two. The J&J jab has been shown to offer 57% protection against mild to severe COVID-19 infections caused by the dominant virus variant in the country. So far, more than 170,000 healthcare workers have already received the single jab vaccine as part of the ongoing implementation study. That's 3 minutes. Tune in next week for another roundup of the top coronavirus stories.